Piece de Resistance, Careers in Clinical and Counseling Psychology. All right, so yeah, really common interest for psychology majors. Most people say this is what interests them most, clinical and counseling. Part of it is just, simply familiarity, right? You're probably more aware to begin with something like counseling psychology than you are with like IO psychology or maybe some other areas. Also, a lot of psychology students in particular want to help people. I mean, it's a common thing that I hear, a reason for becoming a psychology major. That being said, not all of psychology is, this applied mental health work. And regardless of what field you go into within mental health, there's going to be greater or lesser emphases on research, because psychology is science-based field, a little bit similar to like the medical field. So you need to know the background research behind what you're doing. And so all areas of psychology do involve some type of research, and not all areas of psychology, or there are some subfields of psychology that don't focus on mental health treatment at all, right? Like IO psychology or other research positions. Now, it is really common for people to get doctoral degrees in clinical and counseling psychology. I mean, common to relative to the other subfields. So about half of all doctoral degrees in psychology that were awarded recently were either in clinical psychology or counseling psychology. And you might be wondering, well, what's the difference between clinical and counseling psychology? So basically, they're both the same in the sense that there's going to be research involved, a little bit less so in counseling. Also assessment and diagnosis of mental health problems, treatment, supervising, students once you're licensed and in doing these assessments and counseling. But they're different in that clinical psychology focuses more on psychological disorders, more severe psychological disorders, and how to treat those disorders. Whereas counseling psychology, on the other hand, focuses more in general on human adjustment. People who go to counseling or someone who has a background in counseling psychology may not even have a mental disorder, right? They may just want to, develop in some way psychologically, but they're not like impaired, right? So basically, what we have here, if we compare psychotherapy, which a clinical psychologist would do, versus counseling, again, more severe problems with psychotherapy. As a result, the symptoms tend to be longer in duration, affect a lot of different areas of one's life, whereas, counseling, a lot of that's going to be minor stressors and life events, bereavement, things of that nature will be covered in counseling. Focus of treatment in psychotherapy from a clinical psychology standpoint is relieving these symptoms, whereas in counseling it's more just overall help someone to adjust to a stressor, help them grow, and we have longer term treatment in psychotherapy and shorter term in counseling as a result of this, the differences in the severity of problems across the two, commonly seen across the two areas. Can psychologists prescribe medicine? They can in two states, New Mexico and Louisiana. Just having a background or a PhD in psychology, though, is not enough in those states to get the prescription privileges. They have to have additional specialized training and supervised experiences and certification in order to prescribe in those two states. Most psychologists don't want to prescribe medication, even if they could, because of all this additional training, and it brings on a lot of liability, because now you're dealing with side effects and medication issues. So typically psychologists just stick to assessment and counseling. All right. In terms of employment, in the medical field, private practice is relatively common, right? It's a common thing for a medical doctor to open up their own practice. Not so much in psychology. So only about 9% of psychologists work in private practice. Mostly those who are doing clinical work are in hospitals or government positions, nonprofits, things of that nature. And about a quarter of clinical psychologists are in academic settings. So I'm an example of a clinical psychologist in an academic setting. So even though, a clinical psychologist does a lot of research in their training and is research heavy, it's still the case that about 3/4 of people go into practice for their primary career. Only about a quarter go into academia. Questions? Sorry. All right. Yeah. Like a VA, Veteran Affairs Bureau, would be a government setting. Military. Yeah. Government, military, VA. Those would be common ones. Other questions? Median salaries are displayed here. There are other careers that are similar to clinical and counseling psychology. So there's psychiatry. Those are individuals who went to medical school. And, the way medical school works is, you go to a general medical program, learn a lot about biology and all that, physiology for several years. And then you have like a 1 or 2 year specialized residency in psychiatry on top of that. And then one would become a psychiatrist. It's different than psychologists who, go to graduate school for 6 years and just focus on psychology. There's clinical social workers. For that, someone would get a master's degree in social work to get what's called their LISW, to be a licensed social worker. And when they have that, they can practice independently without supervision. And they can also do therapy. So even though they're social workers, they can do counseling. And the research literature supports that they're no better or worse than a psychologist or someone with more advanced training in terms of relieving client symptoms. And there's also counselors and therapists who work with a master's degree. Earning a doctoral degree, there's 2 main doctoral degrees to become clinical and counseling or counseling psychologist. There's a PhD route and there's the PsyD route. Okay. Now, we've talked briefly about the differences. PhD is more research oriented, and as a result, tuition tends to be waived and there's a stipend. PsyD is practice oriented, so we don't have these large stipends and tuition waivers. The other difference that we'll get into other difference in a moment. For both PhD and PsyD programs, you do have to complete what's called a dissertation. Now, a dissertation is like your master work that you do. Basically your capstone experience for your doctoral degree. If it's a PhD program, it's going to be a scientific project where you're collecting and analyzing data. If it's a PsyD program, it may be literature review style of paper on some topic. In either case, you defend your dissertation in front of a committee of 4 or 5 faculty who essentially then say whether or not you're good to go or not in terms of going out into the world and being called a doctor. So they're sort of the gatekeepers, the dissertation committee for the doctoral degree. That being said, the vast majority of people, it's no problem passing a dissertation. If you could get into graduate school and survive however many years, as most people do, you can get through the dissertation. Now, there's also this thing called a pre-doctoral internship that you have to do if you want to become a clinical psychologist. So the way this works is you go to school for 4 or 5 years, take all your classes, do all your practica, and then once you defend your dissertation, and then next you do a 1-year-long practical internship, full-time for 1 year. For me, I did mine in Southern California at a psychiatric hospital, worked there for a year. Now, what happens is there are the American Psychological Association decides which internship sites are good. In other words, the American Psychological Association accredits only certain internship sites who meet certain requirements. And in order to get licensed to practice independently, you have to go to one of these accredited internships. That's something to keep in mind when you're looking at graduate programs, is what percentage of students go on to APA accredited internships? What percentage of students go on to APA accredited internships? What percentage of students go on to APA accredited internships? Because you need to have that internship in order to become licensed. And it's a good indicator of the quality of the program. And all programs have to report that. All PhD programs and PsyD programs have to report that information. If it's less than 90% rate of students getting APA accredited internships, take it off your list. Because you don't want to be in a position where you waste 5-6 years of your life, pile up loans, and now you can't get licensed, right? That wouldn't make a lot of sense. All right. And then after this internship, that's when you can take licensing tests to practice independently as a psychologist. Okay? Questions on that? Look at the rate of APA accredited internships is the point. All right. Now there are, okay, so this is important too. There's 2 different types of PhD, or there's 2 different types of doctoral programs, right? There's programs that are affiliated with a university. And there's programs, in other words, they're nonprofits, okay? And then there are programs who may or may not be affiliated with universities, these professional schools. Some of them, the professional schools, are affiliated with universities. Some are for-profits, okay? So you have PhDs are always going to be affiliated with a university. For example, I got my PhD from Kent State, and then for the PsyD programs, sometimes they're affiliated with universities, sometimes they're not. So, for example, Wright State University has a PsyD program. It's a professional school, but it's affiliated with a university, Wright State University. There's also a school called the Chicago Professional School of Psychology. That's a PsyD program. That's a for-profit business. It's not affiliated with a university. Okay, so that's the differences here. Now, why is that important? You always want to do research into whatever program you're applying to. But in general, if a program is affiliated with a university, it's probably good, whether it's PhD or PsyD. If a school is not affiliated with a university, if it's one of these PsyD professional schools like Chicago School of Professional Psychology, there's a lot of variability in terms of whether or not they're good. Some are good, some are absolutely terrible. Okay, so it's just one of those things. If it's a PhD or a PsyD affiliated with a university, you're normally okay because of the standards those universities have. But you got to be careful about the other professional schools that are for profit. But there are some good ones. Questions about that? That make basic sense? Okay. All right, so another comparison of university-based and professional school programs. So university-based, this is, again, where we have, you're more likely to get funded, do the research, particularly for PhD programs. The acceptance rates are going to be, anywhere from 8 to 15% for university-based programs. PsyD programs are going to be on the higher end of that. PhD programs are going to be on the lower end. And in PhD programs, those are where you're going to get the most financial assistance. You're also going to have smaller cohorts of students, so they're more selective university-based programs, and you see a higher average rate of students securing these internships that I referred to. So 93% of university-based programs, PhD and PsyD, get these APA year-long internships. Professional school programs, these for-profit PsyD programs, the acceptance rates are much higher. But the financial assistance is lower, there's more students, and there's a lower internship rate. So the professional schools, I mean, they can be a really good option. Some of the best psychologists I know went to these professional schools and got PsyDs, one of whom I believe went to Chicago School of Professional Psychology. But you have to do your research, and you're also going to be expecting to pay more. So, for some people that's easier than others. But if you have the resources and you can't get into a PhD program, then a professional PsyD program is not a bad option because the acceptance rates are higher, standards are lower, etc. All right, questions? What questions do you guys have? I need you guys to break up the monotony here for me. What do we have? Yes, thank you. Yeah, there's scholarships, especially with PhD, especially with university-based PsyD programs. There's scholarships, like partial scholarships. Like Wright State has, you get like 10 grand off. Most students their first year get $10,000 off of tuition at Wright State. The PhD, it's been a long day. The university-based PsyD programs will have more scholarships and assistance. Yeah. No. The internship is practical. It's applied. Yeah. You have to have it. It's 2,000 hours of just practical experience. I had, whatever it was, 5 hours a week of research time. But otherwise, I was doing forensic evaluations at a hospital the whole time. And you get paid as well. Yeah. What other questions? Please. Who's interested in this area, clinical psych? Yeah, there's a lot of interest, so what are you guys thinking? Yeah. The way the internship process works, it's similar to what I think they do in medical schools now, where it's like you apply to all these different places. So I applied to 12 different places. I got interviews at 6. I ranked every program I interviewed at. All the programs ranked me. They put it into a computer, and then it spits out whether or not you match with somebody. And PhD programs have high match rates, like Kent State in particular. We've had like 100% match rate pretty much for the past 5 years or so it wasn't a concern. But the main thing is having enough clinical hours while in graduate school, experience basically, face-to-face contact hours, and coming from a good program. Yeah. I chose Kent State because I wanted to stay close to home. I was really fortunate to be able to do that because there's not a ton of PhD programs. So my process was I applied. There's like 12 programs within a 200-mile radius PhD program. So I applied to all those, and Kent worked out really well. So no, it worked. No, not really. So it worked out both ways, in terms of interest and geography. It's like anything else. Oftentimes there's a lot of good options. So you just pick one of the good options. I really liked West Virginia University. The problem was, screw it. The problem with that process, this is good advice for you all, learn from my mistakes. Oftentimes in these interview processes, there'll be a social component to it. And at West Virginia University, it was an awesome campus. They had this really nice social hall, and they had free food and free alcohol. Yeah, and so I had, I didn't eat all day, all right? So I'm on an empty stomach, and it's this stressful experience, and it's over. And I really liked the guy that I was rooming with. We got along real well, and we're talking, had a couple, 2 or 3 beers or whatever, which is too many. 2 or 3 one is enough if you drink. If you drink, have one, and that's it on interviews. So I had 2 or 3, and then it's like, oh, it's time for the annual limbo contest. It's a peculiar contest. So they have this limbo contest, and I'm like, yeah, I'll do the limbo contest, because all the applicants, do the limbo contest. So I'm doing the limbo contest, and I just, for some reason, lose my balance, trip over myself, and roll into the crowd of people surrounding the limbo contest. I don't know if it had any influence on my chances of acceptance there. I imagine it could only have hurt me. So that's a good example of have one drink if you're going to drink. If you don't drink, that's fine too. But yeah, it's a tough balance because you want to sort of be yourself and get to know the other graduate students because they are part of the process. Like whether or not they like you and get along with you matters, right? Because if I'm a mentor, I'm going to have a group of students who are working underneath me, and I want them to get along, right? So if there's somebody who's interviewing and it's like, I don't know, there's bad vibes, or you can already tell there's going to be conflict or drama, it may be that somebody who's really qualified doesn't make it because it's going to mess with the interpersonal dynamics in the lab. So it's a tough balance, but yeah, just keep it to one drink. That's a good piece of advice. All right, so that's good. Any other questions? Yeah, Kent State went much better, the interview. Western Virginia was one of my early ones. I learned my lesson. Although people do crazy things, because then I was a graduate student and I would see, for 6 years, other people coming in and interviewing who would do things like, sleep with other applicants and people in the program. There was this one kid who interviewed. Oh my God, he just got totally trashed and then started to argue with me. Oh my God, about Cleveland sports, which was a terrible idea. He was telling me about I don't know, he was talking crap about Kyrie Irving or something like that. And then he said that he had this formula. He was bragging. He was super narcissistic. He was bragging about how he had this formula that could predict the outcome of any game, about if someone wins or loses. And I'm like, dude, that's total bullshit. What are you talking about? And he's like, yeah, all you have to do is take the statistics at the end of the game and put in this formula and you'll predict who's going to win or lose. And I was like, dude, I'll give you a very easy prediction. The final score. Who has more points? That's your prediction. Who's going to win or lose? And, this guy, I don't know. He was just he aggravated me, as you can probably tell. He just got lost. He's calling people. It's just this whole ordeal. So don't do that. Don't do that. Don't, just keep it together for a night. You'll be all right. Anyway. Yeah, it's just really aggravated me, that guy. And he got in somewhere. So he could get in somewhere, y'all could get in somewhere too. Yeah, and then the other thing was I'm recalling this. He had to be dropped off that night at the bus station, the Greyhound station downtown, and we were in Kent. Keep in mind it's an hour away, and we couldn't find him. So whoever was driving him was driving around downtown Kent trying to find this kid for hours. Finally finds him, and now he's hammered in the car. And no, he didn't throw up, but No, he's just in like had like way too much self disclosure in the car. Like, it's like he did not make it. All right. So yeah, PhD, clinical psychology PhD. Um, what can I say? I don't know. I don't know. Do you guys have any questions about what a clinical psychologist does or how it's different? For me, the big difference is approaching. I mean, I approach clinical work like a scientist first. That's how I approach it. Although not all PhDs do it that way, but it's more of a scientific framework for doing clinical work, for doing assessments. Um, yeah, I like clinical psychology because you have a lot of flexibility. You can be in academia, you can do clinical work, you can teach, you can have a research career. There's a lot of flexibility. I like that about it. So yeah, no, no, I didn't. Actually, to be honest, if you all weren't undergraduate students, I wouldn't even have you call me doctor. The only reason I do it is to create like some boundaries, but I don't like introduce myself as doctor. I don't really I don't think of myself as a doctor. Um, yeah, it's not the best reason to go through 6 years of graduate school, that in and of itself, as you can imagine. Some people do, yeah. 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 In clinical psychology, mental health services in general, something like projected job growth, so like 10 to 25%, depending on the discipline. I mean, mental health rates, rates of mental health problems are rising, suicide rates are rising, substance abuse rising. Um, our life expectancy is decreasing, like the first time in 100 years because of suicides and substance abuse overdoses. So, all right. So yeah, there's a lot of demand, unfortunately. Yeah, a psychiatric institution. Yeah. The way it works is so it was all psychiatric patients. These particular patients, a lot of them were found insane in the court of law, and so you're not just like let go. You go to a hospital, or they're found not competent, and so they have to go to a hospital until they understand what's going on in court. Then they go back to court. Um, so the way it works is you have like 25 patients per unit. This is normally how it works at most hospitals. You have 25 patients per unit, and then each of those units has a team, interdisciplinary team. So there'll be a psychiatrist is normally the lead of the team, no matter where you're at, because of this thing called prestige. That's another person that one-ups you, even if you're a psychologist with a PhD, is a psychiatrist, even though they're not necessarily the most competent. I mean, like anything. I'm just saying, like anybody, just because you have a title doesn't mean you're competent. Yeah, it's not a general thing against psychiatrists. But there's a team lead psychiatrist, and there's going to be a psychologist. There'll be a social worker. There'll be like an art therapist. There'll be nurses. The psychiatrist, though, would be the medical person on the team. So, yeah, it was interesting. At the place that I was at, the psychiatrist, there's this huge scandal because they would clock in because you're behind the fence, so you have to clock in. Basically, you have to hit your card to get in, right? So people don't get out, escape, which did happen. But anyway, the local newspaper went through the records, and the psychiatrists were checking in for like a total of 15 hours a week and getting paid full time by the county. So it was less of an issue with the psychologists, but psychiatrists were. I don't know. Psychiatrists do tend to be. Oh boy, how do I put this? No. I mean, I don't want to make too much of an absurd generalization, but it is the case. I mean, there's plenty of good psychiatrists, but it is the case that psychiatry within the medical field has a lower level of prestige associated with it. I mean, it's just how it is. And sometimes what you'll have is you'll have, particularly with people who are trained in different countries, they'll be trained in like as a heart surgeon or whatever, pediatrician, and they come over to the United States and they can't get a job in that area, and so they'll be a psychiatrist. So it's like there's someone who was trained in something completely different than what they're doing. That can be an issue. But there are still plenty of good psychiatrists. I don't want to make generalizations. And it's a good field to go into if you're into medical stuff. Anyway, so that's clinical psychologist. With a bachelor's degree, working in the mental health field, a few good options are, oh, excuse me. Oh, I skipped ahead. Working in the field of a master's degree in clinical psychology. Okay, so if you want to do therapy independently with a master's degree, you do not want to get a master's degree in clinical psychology if you want to do therapy. The main goal, the common goal for people who get a master's in clinical psychology, who go to a terminal program with a master's in clinical psychology, is to try to get into a doctoral program. The issue is in most states, if you have a master's in clinical psychology, you can't get licensed to practice independently. You'd have to be supervised by somebody who is licensed, which means that you're paid less and you have less autonomy. Now, if you get a master's degree in something like marriage and family therapy, or a master's degree in like mental health counseling through a Department of Education, like we have here, then you can get licensed to practice independently as what's called a LPCC, which is a licensed practical certified counselor or something like that. So that's something to keep in mind. Now, what about a bachelor's degree? Working in areas related to clinical and counseling psychology with a bachelor's degree. The key thing here is you're not going to be doing counseling or therapy with a bachelor's degree, although you can interact and help people with mental health problems. A couple of options are mental health tech, mental health aid. We talked about this briefly a couple class periods ago. They have different titles. They might be called psych techs or aides. They might be called residential counselors or assistants. These are the people who are on the ground with patients in psychiatric institutions, directly working with them, monitoring them, making observations, giving them the medication, and overall facilitating their care. This can be a position where you have a lot of burnout, mental health techs. I mean, it's really difficult work to go to a psychiatric hospital every day and have to, work with severely mentally ill individuals. But that's an option. Another option is a human social services specialist, different titles, case manager, social worker, patient liaison, right? Basically, these individuals, their job is to know all about the resources in a community and connect people with mental health problems to those resources. And so a case manager is one example of one of these human social service specialist titles. I really enjoyed being a case manager. So I worked for the Center for Families and Children. It's on the east side of Cleveland. I serve people with mental illness. Is Lorena here? Okay, yeah, Lorena is also, as we've talked about, a case manager now at Recovery Resources. And you do have large caseloads. So I think I had 50 or 60 clients on my caseload who you're basically keeping tabs on, right? Checking in on periodically. How are you doing? What do you need? And they're going to be at different levels of their recovery, right? Some people, it's their first time ever seeing a caseworker. You really got to get them set up with a lot of different services, housing, Medicaid, things of that nature. Others, you're just kind of maintaining. So you have 60 clients, but it's not like every single one takes up the same amount of time. You drive them to their appointments. You're in the community. So that was a really interesting experience, case management. That was definitely, for me, a good growth experience as a person, because I was like in the thick of it, in East Cleveland, in the projects, people who are severely mentally ill. It was a major growth experience. For me, especially being someone who grew up in the area, went to a local school and didn't really have that growth experience that you often have when you go to college somewhere else. So definitely recommend that job. It is easy to get burned out, though. It's a lot of work. So let's look at a licensed social worker, and she will talk about what she does.
I work as a licensed clinical social worker in private practice as a therapist. I work with individual patients. I do private practice daily. Usually I start at either 8 or 9 o'clock in the morning, and my last patient, I take patients hourly. I may start at 8 o'clock, 9 o'clock, 10 o'clock. I usually take my last patient about 4 o'clock in the afternoon. What I usually do is individual counseling with children, adolescents, adults. I have patients anywhere from right now I have a patient that's 6, and I go all the way up to my oldest patient is 82 right now. I do counseling on any type of topic from depression, stress, behavior issues, children in the school setting, relationship issues. I do parent-child issues, anxiety, or anything up to bipolar disorder. As far as the stress level of the job, it can get stressful when you're working with people and trying to help them work through issues and problems and trying to help them better their life, help them get better. But all in all, I really like what I do. I enjoy working with a different person each hour. And I enjoy seeing progress.
Marriage and family therapist. That's another option if you're
I'm
interested
Dr.
in
Evan Imber Black.
doing
I'm the
clinical work, again,
program
focusing
director
on
for the Marriage and
families
Family
and couples.
Therapy Master's Program
So check out this
at Mercy
video if you're
College in
interested
Dobbs Ferry,
in
New
that.
York.
That'll also require a master's degree to get licensed independently as a marriage and family therapist.
A master's degree
and all the
in
licensing gets
marriage
done
and
through
family
whatever state
therapy
you're
prepares
practicing in.
students
So
to
Ohio has its
first
own mental health
take a
board that
licensing exam
licenses,
to
marriage and
become
family
a
therapists,
licensed
social
marriage
workers,
and family
counselors, etc.
therapist. Graduates
So one thing
then
to keep in
can
mind
do a
is
variety
you might want
of
to think
things.
about when you're choosing graduate
They can work in the
schools,
public sector,
where you're going
in
to end up
mental
living,
health clinics, in
and
hospitals,
if,
in
that
residential
school
treatment,
fits within the licensing
in
criteria
homeless
for where you're
shelters,
living.
in other kinds of mental
Where you
health
plan-
and
wherever you
social
plan to be
service
living.
agencies,
All right.
working with children, adolescents, couples, and families. All of this work is done from an interactional or relational perspective. Graduates with an MFT can also prepare to go to a doctoral program, either in psychology or a program that would give them a doctorate in marriage and family therapy. Some graduates go on to do postgraduate work at a family therapy training institute.
Hello, my name is Jackie, and I'm from the
look
PsyD
though,
program at the
what's
University
your
of Laverne,
description about,
which is in Laverne,
clinical
California,
psychology?
about 40 miles east of Los Angeles. One of the things that I get asked most often is why psychology? You know, how did you pick that to be the field that you want to pursue? And what I found is from talking to classmates and different people in the field is we all kind of have similar stories. A lot of us talk about how, you know, in our personal lives, you know, friends and family members or just whoever tend to really gravitate towards us and ask about, you know, our advice or wanting to talk to us, and, you know, that we are just kind of naturally good listeners. And that has been my experience for sure. You know, I've had friends at different times, kind of random and out the blue, tell me, wow, Jackie, you're such a great listener, and I really like coming to just talk to you and kind of vent about my problems or what I'm going through, and you really listen. And, you know, if I want advice, you can help me out. If not, you just listen. I love listening about people's stories and hearing where they came from and, you know, what their experiences were that led them to where they are now. And so it was just this natural curiosity about people and the human condition and human behavior that I just really, really loved. And, you know, and I loved interacting with people. I'm such a people person, and I didn't want to be in an office all day, like not interacting with people or just looking at a computer. Like that's so not my personality, not what I would really love to do, where my area of passion is. And that leads me to the second question about how did you choose a PsyD program? I always wanted to do clinical work. That was the major focus of my career, what I wanted the major focus of my career to be. So doing, you know, therapy, working with clients on a daily basis, doing testing, and things like that. So for me, I wasn't too much into the research aspect of psychology or wanted that to be a major part of my career. And so that's why I really shied away from the PhD program, just because for me, it wasn't, I didn't want that to be a major part of my career. So I went to the PsyD program because it is more focused on the clinical aspect of psychology and being a consumer of the research, learning and knowing how to read and to take in and to glean from the research that's being done, but not actually conducting the research yourself.
Hi, my name is
If you're interested
Meryl, and
more
I'm in the
in
counseling
psychology,
track
watch
here at
this video.
UWF.
Also,
I'm
we're
studying
going to have
pre-licensure, so
for
I'm
this next
studying to be a
class,
licensed
the
mental
class
health
after that,
counselor.
two faculty
I
and
originally
a
got
graduate
into
student from our
psychology
mental health
because of my
counseling
interest in
program
human
who are going
behavior.
to come in and talk about
But since
master's in
then,
mental health
I've
counseling.
realized
Okay.
my interest in behavior modification
Any questions on
and
masters?
cognitive behavioral therapy, and I really want to work with people
You
with
guys are doing really
anxiety
well. I'm
disorders
very
such
proud of
as
your
OCD
engagement
and
today. I know
hoarding.
it's very hard.
So the
But I'm
licensure
actually very
track
pleased
is
with it.
basically preparing you to take the licensed mental health
Alright.
counselor exam and get your license. And with that comes many requirements required by law. Some of those courses are advanced behavior modification, human sexuality, and substance abuse counseling in your first year. And then in your second year, you can move on towards individual counseling, where you learn all about different theories of counseling, different ways to counsel people. And then you also can go into assessment, where you learn how to actually get life histories and family history and trauma history, and also learn how to use different mental health exams and learn how to score them and use them to actually find out what kind of problems people are dealing with. In some courses, you'll actually have the opportunity to do role playing with other classmates or undergraduate students, and this really gives you the opportunity to practice the skills that you've learned and utilize them with an actual person before you go on to using them with clients, which is what you'll be doing in a practicum and then internship in your third year of the program.